Hello, Guyana. Today, I'm very sad. Very sad because not only that thousands of people are dying around the world, not only because almost 2 million people are affected now with coronavirus, not only because 120,000 people, actually a little more than that, have lost their lives. I'm sad because one of the person who was very closely acquainted to me since I came to Guyana is very sick, is in critical condition, and family is actually looking for a miracle. Ramesh Sugrim, a man I knew since 2014, was a man who is very famous among the patients. His clinic would see hundreds of patients in a week. He would be helping them. He would be advising them. And the cost of treatment he kept very low. So any person who couldn't afford, who is poor, can just go to him. And sometimes he didn't charge them anything. Always smiling. He had a lot of workers with him. So not only he was helping the patients, he was helping a lot of young men and women who work at his clinic and make their living. Ramesh Sugrim is sick, critically sick. He's very close to my heart. I once was leaving Berbice practice and moving to where I live, but he asked me to stay there. And because of him, I used to go there every week. He's now fighting this disease. I don't know exactly what is his condition, but the way they're looking for a miracle, I would pray that that miracle happen. He was a very religious man. He used to sing religious songs. Very good singer. But right now, we all have to pray for him that he recover from it and continue to help the humanity, continue to help his patients. But this is what is happening. We might have lost a lot of us, a lot of friends, a lot of people we know have gone or they are critically sick. Most of the people recovered, right? But we mourn for the people who are gone. And we have to understand that if we don't behave, if we don't follow the rules, this count is going to increase and more of our friends would be in danger. When we don't follow the social distancing, when we don't follow not to shake hands, when we don't follow to sit close to each other, when we don't follow not to touch your face, nose, mouth, when we don't follow to wash our hands thoroughly, and when we don't follow keeping our shoes outside our house when we come back, and when we don't follow taking a shower when we come home and putting the clothes where they're supposed to be and wash them as soon as possible, this cycle is not going to end. Here in Guyana, the count is 47, and we might think that it is less. But believe me, if we do keep doing things which we are doing, and I see it every day, I was out Sunday and yesterday distributing hampers to people who are not working and staying home, following the rules, to help them a little bit with grocery. And this was, I committed to this organization who I volunteer for, Save a Life. This was for that. We went home to home and we distribute it, keeping ourselves safe. And these articles, groceries. What I saw is that people are not serious. I saw the barber shops filled with people. I saw people sitting and drinking together at some spots. I saw people walking together hand in hand. We have to understand, Guyana, that this evil monster is out there in the world, and it is in our community as well. We don't know who is carrying the virus. It has a different presentation in different people. So people who don't have symptoms, people who have less symptoms, when we meet these other people, say aged people, their grandfathers, grandmothers, their parents, they are giving them the disease, right? And we don't know who is carrying it. We're not doing screening tests here, so we don't know. We have to be careful. Otherwise, we will see a lot of people getting sick. I want you to help out those people who are staying home, those poor people. Please help your fellow beings and pray for my friend, Dr. Ramesh Sugrim. He, his son, and his wife, they're all sick, but he is critical. So I hope he make it. I wish he make it, and I pray he make it. Ramesh Sugrim, we want you back. We want you back with your patients. We want you back in your clinic at Berbice. Come back, my friend. Come back.